So when we look at the four-chamber plane, we are in essence cutting the plane which is shown by the blue glass plane, if you like, here. And what this shows us is a transverse section of the fetal thorax. And this is important because it's the only view of the fetal heart which has external reference points. Although not shown here, the four-chamber view of the fetal heart lies in the same plane as a single rib in the fetal thorax. And we can name the structures as we've seen from the previous diagrams, with the left atrium most posterior, nearest to the aorta and spine at the back, and with the right ventricle most anterior. And with knowledge of those structures, we can therefore name the right atrium and the left ventricle as shown. We will perform the scan by sweeping from the four-chamber view to see views of the great arteries. But we can appreciate on the four-chamber view that the mitral valve on the left is inserted slightly further away from the apex of the heart than the tricuspid valve here on the right, and that the right ventricle has a rougher texture with a moderator band rather than the smooth-walled left ventricle. What we're going to look at here is the appearances of the normal fetal heart on standard screening views. Now, the core view which is recommended is to start with the four-chamber view of the fetal heart, and this is the only view of the heart with good external reference points. So what you will see as I zoom this image up is that there is a single rib around the fetal thorax, and this marks the plane of the four-chamber view. When we look initially here at the size of the fetal heart, we can see that the fetal heart occupies about 1/3 of the area of the thorax, and that the apex of the heart is pointed anterior and leftwards. We should see that the left and right hand sides of the heart are symmetrical. In order to work out which is left and right, then clearly the position of the apex of the heart needs to be worked out once during the examination. But having done that, in the normal heart, the right heart structures are more anterior, nearest to the anterior chest wall, and the left heart structures are more posterior, nearest to the spine. So here we can see the left atrium, which connects through to the left ventricle through a mitral valve, and the right atrium, which connects to the right ventricle through the tricuspid valve. The left ventricle and right ventricle are of similar size, and it can be seen that the left ventricle has a typically smoother wall than does the right ventricle, which is more coarsely trabeculated here, particularly towards the apex. The mitral valve inserts further from the apex than the tricuspid valve does, and on the ventricular septum, atrial septum, and the atrioventricular valves form an offset cross. Offset in the sense that the mitral valve is further from the apex than the tricuspid valve. There is a natural communication between the two atriums in this position, known as the foramen ovale, and there is usually a hint of the pulmonary veins draining to the back of the left atrium. Both of the tricuspid and mitral valves should be seen to open freely, and both ventricles should contract dynamically. On sweeping and angling the probe inferiorly, the position of the abdominal vessels can be seen, and of the fetal stomach. So the fetal stomach is seen here to the left, with the descending aorta anterior and to the left of the spine, and the inferior vena cava anterior and to the right of the aorta. Here is the normal four-chamber view again, and it can be seen as we sweep up and down that the fetal stomach and the fetal heart are on the same side. Just to point out one artifact here which sometimes causes confusion, and that is that when you go very inferiorly in the four-chamber view, you can see a structure here coming along the inferior border of the junction between the left atrium and left ventricle. This is the coronary sinus, but this can cause the appearance of the loss of differential insertion of the valve, the tricuspid valve here on the right, and the mitral valve. But if you look carefully, at the point where you see the coronary sinus, you don't actually see much of the mitral valve, so you're slightly below it. And if it's just that, as you pull up, you now see the primum septum normally to confirm that there is a normal primum septum there. And as you angle inferiorly, you see that again, this line of the coronary sinus. This is a normal finding, but it's important to recognize as something which may, if you're scanning slightly off axis, may cause diagnostic confusion. Occasionally these coexist where there is actually an atrioventricular septal defect, and in that situation, confirmation of the short axis views of the valve to confirm that the left AV valve is indeed a normal bileaflet valve is important.